Welcome all to today's session titled Conflict-Induced Environmental Degradation, Impacts on Climate, Displacement, and Health. This event is hosted by the CLI Health Program at the American University of Beirut Global Health Institute in collaboration with the International Organization for Migration Regional Office for the Middle East and North Africa. This virtual panel is part of the 2025-2026 joint event series organized jointly by the Global Health Institute at AUB and IOM, focusing on the climate change, health, and migration nexus. My name is Nurhan Haidle. I am the CLI Health Program Manager at the AUB Global Health Institute, and I'm honored to open this event today. Today's virtual panel will bring together local, regional, and national experts to share field-based insights and reflections drawn from operational experiences and country examples, exploring how conflict intensifies climate stressors and how this may have long-term implications on health and human mobility across the MENA region. The discussion will be followed by a Q&A session, so please, if you have any question, feel free to drop your questions in the question box chat below. The discussion aligns, next slide, please. The discussion aligns closely with the Global Health Institute's mission, which was established in 2017 to shift global health toward a model where Global South are not only implementers of the solutions that were designed in the Global North, but rather can design and lead context-driven solutions. So our work is grounded in an interdisciplinary, locally driven approach that is tailored to the communities that we serve. Within GHI, the Climate Change and Health Program is one of its core thematic programs. It addresses climate-related health risks, focuses on vulnerable populations, and works on building resilience and preparedness of the health systems and communities, with a particular focus on fragile and conflict-affected settings like the MENA region. So it's now my pleasure to introduce our moderator for today's session, Dr. Osama Janabi. Dr. Al-Janabi is a public health professional and national program officer, team leader for South and Central Iraq at IOM's Migration Health Division. He has over 10 years of experience in public health, humanitarian response, climate change and health, emergency preparedness, and migration health programming. He has worked with the Iraqi Ministry of Health, WHO, and UN agencies on health system strengthening, climate resilience, emergency response, and migration health governance, supporting national and sub-national public health programs in Iraq. I would like now to hand over to Dr. Osama to lead today's discussion and take us through the panel. Dr. Osama, over to you.
Thank you so much. Good afternoon, ladies and gentlemen. Welcome. As we gather today, we confront a reality at intersection of conflict, environmental degradation, and the human displacement. When ecosystems are torn apart by conflict, climate impact are magnified and vulnerable communities are forced to move. In the region, we have witnessed the first hand of these challenges destabilize health system and uproot lives. As we are bridging scientific evidence and policy, our shared goal is to find a practical human-centered solutions that restore both our environment and dignity. Today, with experts spanning environmental science, WASH, climate policy, and migration health, we will explore how these crises intertwine and what collective actions can be drive in resilience. So let's dive in. And first, I would like to introduce Dr. Najat Sleba. Dr. Najat Sleba is an environmental scientist and member of Lebanese Parliament since 2022, internationally recognized of her leadership, science-driven policy making, environmental protection, and governance reform. She served on the Parliamentary Environment Committee before entering a public office. She was a professor of chemistry at the American University of Beirut, where her research on air pollution, tobacco smoking toxicity, and waste management positioned her among Lebanon's most cited scientists within over 160 publications and 8,000 citations. And she received a major of rewards, including the Royal UNESCO Award for Women in Science in 2019 and a National Order of Cedar, and she was also named as the BBC 100 Most Influential Women in 2019. and her political of 12 most influential people in climate justice 2021. Her work bridged scientific evidence with public advocacy, producing a concrete reform for advancing environmental justice, transparency, and institutional accountability. So welcome, Dr. Najat Asleba. Dr. Najat, my first question is about from the scientific perspective, how does the conflict contribute to environmental degradation and in turn of the intensity of the climate change, particularly through the air pollution, and as the ecosystem and livelihood are destroyed during the conflict, how these environmental consequences shape displacement and migration pattern, including people ability and eventually on their return to their own lands. Sorry, Doctor, you are muted.
Good afternoon, everyone. Thank you for the invitation. I'm so honored to be among the speakers today. Rula, I just want to say a special hi. We miss you. I miss you. I want to also thank you for giving me the opportunity to talk about what's going on in Lebanon and what has been going on in Gaza. And those are the recent, probably most pertinent conflict zones that we have been living in and through. And I have been doing a lot of reflections of what it means to have bunker busters and to really to really excavate everything in front of or in the village, in front of the occupier, Israel. This has intrigued me to do a lot of research about this subject. And what we know, what we understand from the literature is that the damages are not only in the air, they are also at the surface of the earth, meaning the surface soil, the surface water, and most importantly, underground, meaning the soil under the earth, under the surface, and the water under the surface, and more. And I want to say and more because I want to explain how when we have tunnels and the invader, the occupier, wants to really, explode all the tunnels that are present under the ground, they use bunker busters that are loaded with explosives and sometimes have uranium at the tip of the explosives because they want that the tip really with uranium help them penetrate deeper in the ground. And when we talk about the soil, and I'm talking about the surface soil and the underneath soil, we're talking about really a thin layer. So life as we know it is only a few meters deep. It's not more than this. And this few meter depth, we have all the physical and chemical and biological transformations and processes that usually make what life is. And those few meters of depth actually interact with the air and make the life of people on Earth. And when we load the soil above the surface and underneath the surface with chemicals and the byproducts of these explosives from heavy metals and products of TNT, and also shake the ground so that the filtration of water and the positioning of all these aquifers is shaken and perturbed, we're actually very close to what we call an ecocide, meaning we're killing life for generations to come. And this is, for me, is very perturbing. It's very painful because the literature says that it takes generations to actually for people to restore life in these places. From here, if we want to talk about displacement and we want to talk about climate change, so all of this is exacerbating the situation that is already stressful. And when we talk about people being displaced from this area, we're talking about long-term displacement, because in order for people to come back to these places, even though they're not really forced to migrate due to climate change, they were forced to migrate due to conflict. In order for us to bring them back, it's going to take a lot of efforts, and it's not usually the normal effort that we do. We go take samples and we just strategize to see how we can clean up what we see. This time, it's going to take a lot more effort to really understand how deep is the damage, and we need to have a new strategy altogether in order for us to restore. I would stop here, but I just wanted to share with you the painful ecologist in me, ecologist in me that is really thinking about what's happening. And I really call on platforms like these to have us all think together about this disastrous that we're living in. And it's, I reiterate, it's not only about counting the damages, it's about understanding the depth of the life-threatening that is in these conflict zones. Thank you.
Thank you so much, Dr. Najat, and how that's explaining about how that's affecting on everything. It's not but only on the air, it's also affecting on the soil, and these leads to affecting on generations. And it's one of the most important points that need everyone to know and to work on is for the future. Thank you, Dr. Najat. So I'm going to Dr. Areem Shamour. Dr. Areem, she is a water research, and she is a public health researcher and expert in water, sanitation and hygiene, WASH, health and antimicrobial resistance in a fragile and conflict-affected setting. She held a PhD in water technology and master degree in public health. Her work focused on interconnected impact of environment degradation, water insecurity, and climate vulnerabilities, and on health outcomes, and particular attention on vulnerable population and displacement context, with an extensive experience working with the national and international organizations in Palestine aimed to the strength WASH system and public health resilience. Dr. Areem, she has received a fellowship and award, including from AUB Center for Research and Education in Ecology of War, and her work focus on evidence-based approaches onto the water and environmental health in a humanitarian and conflict setting. Welcome, Dr. Areem. Dr. Areem, based on your work in conflict-affected setting and the fragile health care system across MENA zone, how does the degradation of the water infrastructure contribute in the border health vulnerabilities, particularly in the region already facing a climate-related water stress? And what cascading of the implications does have to diseases burden and health system resilience and displacement dynamic in the vulnerable communities?
Well, can you hear me?
We can, but if you can just hear, the mic is low, so.
Okay. Okay. Thank you, Dr. Osama, for introducing me and for giving me this opportunity. Thanks to the AUB Global Health Institute for this webinar and for this opportunity. Actually, I wanted to start with a simple principle that frames my intervention today, which that destroying the environment of a population is not just a harm. It's a systematic dismantling of the biological foundation of life. And what's happening in Gaza and Lebanon, as Dr. Najat said, it's one of the clearest and most devastating examples of this principle in real time. And when speaking about Gaza, because I'm from there, the place that endured protracted conflict for decades, and over the past 2 years, faced both the genocide and ecocide, producing human environmental crisis that we started to see the health consequences alongside with the physical harm. So I might address maybe 3 to 4 pillars of that crisis related to water sanitation and dignity or hygiene issues. So when we are speaking about water, and I'm echoing what Dr. Najat said, that the destruction of the water infrastructure and sanitation infrastructure might lead to the leakage of raw sewage that can reach the aquifer, and the aquifer in many cases in conflict settings is the main source of water. For example, in Gaza, and during the last 2 years, people started to use cesspits instead of the public sewage networks, and this is expected to exaggerate the already existing deteriorated quality of the aquifer, even prior to the 7th of October. And you can imagine also that the share of water that people can have within the conflict settings, within this war zone. In Gaza, for example, according to Oxfam reports, people in overcrowded shelter received less than 5 liters per capita per day. And this is far below the WHO recommended quantities, and even far below the emergency sphere standards. And that water, even it's not safe. It has microbiological contamination, which has been reported by several published reports by UNICEF and UNRWA. And based on one of my studies that started as a pilot with Global Health Institute, we have discovered microbiologically contaminated water within healthcare facilities, the area that usually people seek to get to be healthy and to recover from their illness, from their wounds. Imagine that based on our research, we found that the most of the water resources were contaminated with microbial-resistant bacteria, including the Esbel coliform and a multi-drug-resistant Pseudomonas, MRSA, methicillin-resistant Staph aureus also was found within the water supplies. And when it comes to the sanitation also, the consequence on health, particularly within the overcrowded shelter, started to appear in the reports of UNRWA and UNICEF. There is a surge in watery diarrhea within the overcrowded shelters in Gaza. Hepatitis A has been documented also. Skin diseases were prevalent within this context. The re-emerging of poliovirus, it was by itself a health crisis when it's first been detected within the sewage, the raw sewage found within the overcrowded shelters. And when we speak also about the displacement with environment and the consequence on public health, it's a nexus that need to be considered when we report about the consequences of the wars and the conflicts within the area. the forced movement concentrate people into spaces with no sanitation, with no safe water, with no waste management. So the accumulation of solid waste and the presence of raw sewage with no access to safe water, in addition to the unhealthy food, the available low quantity and quality of the food, it will end up by having stunting people, immunocompromised, ill patients, and it might lead to mortality even, the indirect toll of the conflict, the wars that usually not counted in the casualty reports we see. The contamination that have been highlighted by Dr. Najat also, it's the long term that can persist with generation. The recent reports issued by UNIT about Gaza, the assessment, the report highlighted around 62 million tons of debris in Gaza. And the debris is not only rubble, it contains, if beside the bodies that had been buried under the rubble, beside that, it contains the unexploded ordnance, it contains heavy metals, it contains lead because of the destruction of solar panels. It contains asbestosis. It contains raw sewage because of the public sewage network destruction.
Thank you so much.
Okay, just last thing. The remote sensing also data showed that more than 97% of the crops have been damaged and destroyed, and this is related also to the water water and food security together, and all of that is not gender blind because, as usual, women, girls, mothers carry the heaviest burden within this context. Thank you, and back to you.
Thank you so much, Dr. Arim, and thank you for flagging and highlighting the effects on the sewage water and how it's affect on the vulnerable communities, and also the drinking and needed water for the people, especially when we focus about the children, and also that the rises of the bacterial and viral diseases may have happened during the conflict. And thank you, Dr. Arim. Now we are going to Ms. Rola Majidinani, and Ms. Rola, she joined the International Center on Agriculture Research in Netherlands, ICARDA, in January 2022 as a senior climate advisor, supporting the ICARDA to align programs on food system transformation within the climate and sustainable development agenda. Prior to that, she served as the director of the Arab Center for Climate Change and Policies and the cluster leader of Natural Resources Sustainability at the United Nations Economic and Social Commission for Western Asia. She has an extensive experience in integrated management of natural resources, water, energy, and food security, working with the public and the private sector institutions and supporting intergovernmental processes to achieve region and specific development goals. She is presently serving as a steering committee of the Global Water Partnership and has been designated as the Distinguished and Associated Fellow at the Carbon Institute, March 2026. So welcome, Ms. Rola. From your climate policy perspective, how do the conflict dynamic affected the resilience and the productivity of the agriculture sector in the region with already low adaptive capacity and system fragility, and how the overlapping stresses contributed to the food insecurity and potentially drive migration among agriculture communities?
Thank you, Dr. Osama, and very happy to join this panel, and indeed happy to see Najat among the panel. It's been really a long time, and wish you all the best. You have a very challenging task ahead of you, and I know the great work that you are doing in Parliament and as a scientist. So Happy to see you in this context. Well, first, let me say that climate in fragile situation, climate never happens in isolation of other major problems like weak economic, socioeconomic situation, governance deficiency, deficient institutional structure, and an eroding adaptive capacity, whereas we often speak about the strong adaptive capacity and the strong resilience of our people, and that have lasted throughout this very challenging wartime. Still, it is you see that capacity eroding, and in its most in its severe form, and let me focus here on the agriculture sector and the livelihood, which really in our region already we have a region that is affected by climate change. It is with increasing temperature, with heat waves, and with reduced water rainfall. Already we have these big climate problems to deal with. And when, let me start by saying, to adapt to this, you really need well-functioning institution to address these challenges. You really need long-term planning, early warning system, transparent institution that can allocate resources in a transparent way. You need to have trust in the capacity of these institutions. And with this, yet what we have in the region with the weak structure and the weakened structure and the devastating wars that we have had to suffer from Israeli aggression, we are our institution can take so much. Our institution cannot really function in harmoniously across the different fields, whereas you really need multidisciplinary ways of looking at these in dealing with climate issues. You have that inability, the technical weakness, but also the inability to enforce legislation. So we really have a paradox here. We're asking our institution to support rising problems in climate as a result of climate change, and yet we don't have that capacity. Climate affects the different aspects of life, the social, economic, institutional we spoke about, but also in a very direct and indirect way, the agriculture sector. Dr. Najat spoke about the contamination of the soil, and there are problems that we know about and problems we have yet to discover, and in a longer term perspective. The degradation of the infrastructure, the inability, the irrigation system. And we are a region that really relies on irrigated land in our region. And we have, and we see that this is that infrastructure, the canals are destroyed, have been destroyed. People and rural communities have not been able to go and harvest their and plow their lands and harvest their lands in southern Lebanon. It has been a devastating situation with over 10,000 hectares of land that has not been harvested properly, and this is leading to food insecurity. If you look across Lebanon, the damages are even much bigger. We were talking about over 46,000 hectares of land that is damaged and contaminated by the continuous bombardment. And this is the destruction of orchards, of greenhouses, of irrigation canals. So and that erodes the livelihood of the rural communities, with a cascading effect on other sectors and on the rest of the population. And I don't want to just zoom in on the rural community, but it has that cascading effect throughout in a longer term and on other sectors. The adaptive capacity communities, rural communities do try to cope in a negative way by selling their livestock, by taking their kids out of school, by reducing meal intake. This is that pressure, we don't see it straight away, but this pressure, and it builds on in a time perspective and in a capacity, physical capacity of people in the labor force, in the social cohesion. So really looking at these multidimensional aspect of poverty and multidimensional aspect of the impact of climate change requires a much more in-depth looking at institutional capacity, but also at the political level as much as at the local level in that. We have the cases of Lebanon, the cases of Gaza is really, it's close to famine. It is in a famine situation with, as Dr. Reem mentioned, the groundwater is contaminated, not even good for human consumption, and much less for irrigation purposes. In Sudan, you have the displacement of over 20 million people that have left people and farmers and livestock, also the destruction of major livestock as a result through not being able to follow the climate pattern and adapt to changing seasons. Their mobility has been constrained in that sense. In Iraq, reduced the flow of Euphrates and the Tigris have had very significant impact on the agriculture sector with the increased salinity of the land and increased stress on the local community, reduced in quantity and in quality. And that is, one looks at that in this is not just because climate is happening, but because also you have a series, it interacts with bad policies, with bad management originally that really combine to make the situation much stronger. And this is why we talk about climate as being a stressor in that sense. From the literature that one looks at in different regions, people speak about climate migrants. In our region, this is overshadowed, of course, by the political situation and the insecurity situation. And we tend to forget that climate maybe is a push factor, but people don't tell you they don't migrate because of climate. People migrate because of the lack of social services, dire economic situation, insecurity. And Lebanon, I don't need to elaborate what we are. It's beyond description. The bombardment and the migration of over 1 million people having to forcibly displaced from their region, from their land, and with that dire impact on the agriculture sector. So in looking at the different cases, we are a hotspot as a region. We are a climate hotspot, a drought hotspot, but we are also a conflict hotspot. And really all these combinations are a recipe for the degradation for the degradation that we are seeing of the food system and the livelihood of the people in the region. I think that one needs to look at, I've looked in the chat box at, so what do we do? Maybe I will leave it to the second round of the intervention, but really one needs to be realistic in the approach that we say. There is no one solution solution fits it all to all these challenges that we see in terms of the interaction between climate, poverty, environmental degradation, and conflict and migration as a result. But we need to really put again put the emphasis and the priority of looking at the agriculture sector, not from a technical perspective, but as an entry point for building peace, for stabilization, for really bringing back these destitute communities back to their land and to their productivity, and to bring them hope in rebuilding their country.
Thank you so much. Thank you, Ms. Rola, and thank you for showing and explaining about the needs of early warning system. And of course, there is how it's linked of all the resources, water, energy, and food, and how also the conflict affected the people and their agriculture. Thank you so much, Ms. Rola. So we are going to Dr. Samir. Dr. Samir is a general surgeon and migration health specialist, currently serving as a chief migration health officer at the International Organization for Migration in Cairo. Originally, he's from North Macedonia, and he has extensive experience leading the health and the humanitarian program across Lebanon, Somalia, Liberia, and Sudan, Afghanistan, and Macedonia. Over the course, Dr. Samir, he held several leadership and role emergency responses in migration health, humanitarian healthcare, including during Ebola outbreak in Liberia and in Kosovo crisis. His work focuses on improved healthcare access and protection for the vulnerable and displaced population. Welcome, Dr. Samir. Based on your expertise and experience in operational projects in Somalia, Lebanon, Iraq, and other MENA countries, what are the main stress points and flying fragility in health system when climate-related displacement overlap within conflict, particularly in the host community?
Thanks a lot. Thanks a lot, and I'm honored to participate with such panelists as well as auditorium and have opportunity to express my experience with the good, bad, and ugly sides. Unfortunately, worked in very beautiful countries with extremely productive people, teams, but unfortunately, during the conflict, post-conflict, protracted conflict situations and emergencies. I've been honored to be 6 years in Lebanon during the beautiful time, as well going through the COVID, through the explosion at the border, and all these socioeconomic disturbances. Well, we saw opportunity to support definitely the government, the partners on the ground, and to work with UN family as we became also UN Migration Agency as of 2017. In principle, the experience when I moved to Middle East, particularly Syria, then Jordan, Kuwait, Iraq, I could see the impact of the conflict in reality. Later on, we got the elements of the climate change that were increasing and being very, very crucial when certain events in socioeconomic life could be developed. In Iraq, First Gulf War, 1991, having all these burning 700 fields in the Kuwait, having the leak of oil that remained even 30 years after the events, contaminating the soil, being in charge of medical evacuation and seeing the impact of the depleted uranium and cancer among children as well as other population, but came to the level when moved to Darfur, where it was protracted emergency, and seeing how the climate change with the displacement of population because of conflict could be somehow suppressed with the impact that they had in the life of people and having the peace building component. We'll talk about later on that, but let me focus on the part of Somalia, Somaliland, Puntland, Jubaland, where the climate change had devastating impact in the aspect even of this conflict situation that existed. Even in certain areas, the governments, local governments, were more managing the situation, having more stability, but had to deal with the impact of climate change. When you have loss of agriculture, surface, loss of the cattle, as you know, Somalia had, let's say, 25 million goats and sheep, 16 million of the cattle, and 16 million of camels, exporting mainly to Gulf countries when we look. But then we had this crisis that came out because of the drought. It was seen in the Somaliland when we had the internally displaced people in significant amount, but worked very closely with the government, with the voluntary return, and reintegration ministry, where we manage the displaced people that could not go back to the places where they couldn't have any more to start developing what was destroyed, not by war, but by climate change. But we got interventions of new sites where, together with Norwegian Refugee Council, with Danish Refugee Council, with local authorities, with local NGOs, we managed to have new settlements that we made possible to have 5,000 and above, with water sources, with agriculture parts, and even to have microfinancing for developing the local economy and have sustainable stay, even in 2 years to be able to be the taxpayers. Well, this was like the microfinancing that was like revolving fund that we could support other 60 to 80 families every year, making stability and having production in agriculture and having people to have opportunity to work and sustain their presence in these new districts. So we made that in couple of occasions in Somaliland, in 2 locations. But then when we look in, and normally we were providing the healthcare service, starting with the mobile, but then we had the stable facilities, solid structures that we put in place, that we were doing the even with mobile, continuing to do the vaccination accelerated, but the services were there, including the maternal care. So we had even delivery rooms in these places that make people to stay in the facilities, as well as supporting the main hospitals that were in the locations where we established this. When we look to Syria, it was most interesting because we know from 2006, 2010, it was drought after drought after drought, impact from Mediterranean side, Eastern Mediterranean, and we ended up having the relocation of rural population that was 8.9 million at the time when they were 25, and getting to 12.9 to move into urban settlements and the periphery with not enough infrastructure. When we are looking about the water sources, open defecation was very obvious, and it could end up to have the situation, not enough health facilities to manage, that ended up with conflict that destroyed even health facilities, destroyed the agriculture sites. You got 80,000 barrels of bombs that were thrown during very short period, that made also the mining of the place to have many incidents because people could not go and be able to produce their crops. So it was more devastating, and we saw this big influx that happened toward Lebanon particularly, because traditionally there were existing situations, Syrians to cross the Lebanon, to go to the North Lebanon and to Bekaa and to working in agriculture, assisting like labor, seasonal work. But that became more constant because of the conflict that started 2011, yeah? And we had in 2000, let's say 12, 13, we had already 340,000 refugees that were in Lebanon registered. I'm not talking about these that came among these 1.5 million in 2020 after stopping even registering them to have Syrians. But I had opportunity to work in the northern part of the country, moving with my team, supporting the accelerated immunization campaigns, as well as immigration office, where we were training people how to use the personal protective equipment in part of preparation for having the outbreak that nobody knew, neither me, but it went quite well because all these border points, including the Rafik Hariri Hospital, were supplied by the PPEs much ahead of the time, including the Masna border crossing point. But what we noticed in the north, we had the Syrian refugees, and they were in only one round of 10 days that we supported the Ministry of Health and the local health authorities having the vaccination accelerated, because in Lebanon always there is a tail of measles. So, and we were running up the together with the local authorities, as I said, and we managed to identify 25 new camps or camp-like settlements that were not registered even in the maps, because Lebanese were very good in registering this. But this was like our contribution, as well as providing the support in kind and pro bono assistance, made a difference in that end. And normally I mentioned the COVID, it came now on another cost, not having the supplies. So even Ministry of Foreign Affairs, who had to have contacts with many delegations, we made sure that they are supplied. We had to have these supplies on their end, and not to talk about running 2 isolation centers. We had a lot of migrant workers that were over 250,000 that were left like in one side. So we took care about Canadian Lebanese hospital to be the site where we refer the refugees and migrant workers, including host communities, working closely with also not only authorities of hospital, but also with local NGOs.
Thank you, Doctor. Thank you so much for this explanation and how it's affect on immunization and infection. Maybe there is some more that we need to hear from you in the second round about how this is these approaches and these evidence and how this is on the affecting on the critical and reducing the healthcare system. So just and I'm going maybe to the round 2, and
Thank you.
I don't want to take your time, and thank you so much, Dr. Samir. So. And just in a brief, and doctors, and regarding, I'm starting with again the round 2 with the Dr. Najat Sleva. From the policy perspective, and giving these stresses are no longer confined within national borders, but increasingly becoming a regional and the global challenges. What are collective mechanism and the collaborative mechanism are must be urgently needed to be strength, accountability, environmental recovery, and long-term resilience.
Yes, thank you. I did some analysis and review of the international treaties, conventions, and agreements on conflict zones, on soil, and on protecting migration from climate change. I think we have over 23 different international agreements and conventions that we can really use in order for us to push some justice in this to this problem. But at the same time, I think we have one problem that I spoke about earlier. Is it the devastation of the soil, and whether this can be called an ecocide or not. This is a long stretch to call it an ecocide. And this will require lots of testing and lots of experiments and evidence in order for us to prove that life as we know it is no longer valid. Okay, But this does not mean that we need to let go of the problem. I think what we need to do is start collecting the evidence. I know that Dr. Mirna Dumed is always questioning whether the international treaties have any use because they're not really honored all the time. This is, I think, without an international order, none of the countries can function on its own, and without those treaties and conventions, I think we will have a major chaos. Of course, we would like them to see more implemented and more honored by the different countries, and this would take a long time, and it would take a lot of evidence to prove that the invasion and the occupation has caused all of this. From here, I would really ask the international community and the local community. We have great scientists and great doctors, medical doctors, and even documenters who all of us are called to really start documenting all the damages that is happening. I think without us being ready to prove and to document everything that is happening, we will all continue to talk about it, to just complain about it. And I'm not really criticizing anyone. Of course, we need to address the problem, but I'm saying in order for us to go beyond the problem, we need to gather all our efforts to really compile the evidence and put it in one file altogether and work towards the solution and also towards holding people accountable. So that's from one hand. The other hand of why we need the documentation and why we need to continue pushing into collecting the evidence is one aspect that we probably didn't talk about much on this panel is the cultural aspect and the identity of the people. So when there is such massacre to the ecosystem, and such erasing of all the cultural attachment that we have to the site, we are definitely erasing the presence of a humanity on the soil. And that's how and why documentation becomes extremely important. And seeing all these cultural sites being completely destroyed and seeing our soil being completely degenerated is basically an attempt to erase our culture. And from here, I would call on starting the documentation today, because every one of us has to really put his attachment to the soil on paper so that our history is made by us and not by somebody who's invading our territory and writing our own history. So having said that, I'm trying to say that we need to rely on existing conventions to talk about culture, to talk about history, to talk about our presence on these territories. But from the other side as well, we have another homework to do, that we are the people who are suffering from this, and there is not enough conventions that will protect people from being erased. There is one convention that talks about ecocide, but it doesn't talk about the degeneration of the ecosystem completely, including the cultural and the history of people. And I think this is our contribution to the world by really initiating this effort of bringing forward a new convention based on what we have lived in Gaza and Lebanon, so that other civilizations do not go through what we're going through. Thank you.
Thank you so much, Dr. Najat, and thank you for the call that we need to document everything, as this is also to be a part from strengthening the accountability and across all the borders, and this need, because it's a need to have a long-term responsibility and to have a good on environmental recovery. Thanks again, Dr. Najat. Dr. Arim, given the instructions, challenges, and what policy priorities would be recommend to strengthen climate resilience, water system, and enhance community resilience in setting when fragility and conflict and the climate vulnerability overlap?
Well, thank you again, Dr. Osama, for the question, the excellent question. And actually, I fully agree with what Dr. Najat said about the need to document things, particularly that we are currently unable to prevent the war because it's happening. At least to document what's happening and to help in making the violation accounted for. The other thing that we are speaking usually about the right to health mainly, and we need to have a kind of shifting in our narrative to start speaking about the right to water and right to sustainable environment as a basic rights, and they are part of the public health emergency. It should be part of the public health emergency response. And I do remember in 2024, over 200 health journals called the WHO and political leaders to declare that climate is a global health emergency. And that the destruction, for example, what's happened in Gaza with the water sector and sanitation, it's not only an infrastructure, it's a biological infrastructure of human dignity. And this is a direct threat to the human life. And we need to consider it within our humanitarian intervention from day one, to integrate it and to have allocated budget for that, because it's the biological infrastructure of dignity and life. We also need to consider the combined vulnerability of climate and conflict. They are a nexus, and they are not parallel tracks. They fuel each other, and they amplify the consequences on health. And we need to again, it's not a green agenda, it's survival agenda. So we need to consider it within our political decision.
Thank you so much, Dr. Ronnie. Dr. Arola, what evidence-based strategies would be highlighted to strengthen the agriculture sector in a climate-vulnerable setting and supporting adaptation and conflict zone? Sorry, Dr. Arola, you are muted.
Apologies.
No worries.
Okay. So one needs to look at the rehabilitation of the agriculture sector as a full-scale effort, as a full-scale effort that is right from the start of the process of reconstruction and rebuilding, and not as an add-on. Agriculture, people look at agriculture only from the perspective of how much it contributes to GDP. But when you look at the livelihood of people and how many people it employs and the communities it has and their link to the land and the identity that Dr. Najat spoke about, one needs to put it at the forefront of any reconstruction and rehabilitation effort. And in that, we don't just mean rehabilitation of buildings and roads, but really of the whole value chain, looking at the vaccination of livestock, veterinary services to livestock, rehabilitating the productivity of the land, assessing the damages, as we said, in present immediate damages or the damages that are observable and long-term damages, and the opportunity cost. We know that, for example, the phosphorus phosphorus the bombing and the phosphorus impact on the soil has long-term impact on soil erosion and inability to retain water, for example, in the soil, and it would accelerate desertification. So one needs to look at these in totality, and there are enough scientists, there are enough researchers, research facilities that can really contribute in that locally and from the region. One needs to also look at how you can restore climate and encourage climate resilient crops and seeds. These are very important and have been traditionally part of our agricultural practices, and that have been from different factors of economic development, of major, there are multiple factors, but have been, in some ways, we have lost them before with climate change and now with the conflict situation. Here, I would like to maybe bring the one of the success stories under ICARDA, that they have establishing gene banks, some of the best gene banks in the region and even worldwide. And with the conflict, ICARDA sent the seeds, over 150,000 types of seeds, to Svalbard in Norway, and they have managed to safeguard them. And this, because of with the conflict, they have been able to retrieve some of these seeds, which would preserve the lineage of our crop and seed facilities in the region and the richness that we have from this region. It is very also important to look at crops that are water resilient, that are heat resilient, and drought resilient. And we have had there have been let's say disregard or neglect of some of these dryland crops, lentils, millet, sorghum, and these are very important for for poorer communities and for communities living on rangeland and remote areas. It is also very important to look at these at mechanisms. Again, we spoke about weak institutional structures and governance deficiencies that we have. One needs to look at how can we, through a decentralized process and community-based process, support the communities to really improve and restore their land through water harvesting, through better water management at the community level, at decentralized level, and in harmonized with the central government. I'm not saying to erode the role of the central government, but one needs to invest in these efforts at a decentralized level. Let me also here make a word of warning. Having worked a lot with donors and international agencies, I can tell you that sometimes they take a shortcut and the back route to work, to just work with NGOs, and they forget about, for example, water user association, about farmers cooperatives. There are farmers associations that can effectively do that job, and NGOs can play a very important role. I'm not saying no, but one needs to also look at these local and indigenous and local knowledge that that have been accumulated through the years, and the local networks that they have, farmers networks, for seed multiplication, for crop, for sharing knowledge about improved and or farming under climate stress. These are not very well exploited or harnessed to as much as they could. One could look at them. Also, what is very important from that agriculture setting is to move or link humanitarian with all the way to self-sufficiency and developing capacity at the local level. One cannot only just look at the humanitarian level, but long-term rural recovery, which involves employment, new type of skills that are required, and how you can harness young people, bringing them with their acquired knowledge, whether in IT, they're in research and technology. There are a lot of improvement that they can harness, and we can make good use of them. One needs to look at, again, the agriculture sector, not just from a technical perspective or from a narrow perspective, as I said in the beginning, not from just how much it contributes to the GDP, but really how it can be harnessed through that multifaceted approach to really rebuild lost society that have been displaced, and bring them back to be really the power behind the sustainability in a longer term perspective.
Thank you so much, Dr. Aruna. So back again to Dr. Samer. Thank you, Dr. Samer. You raised several important points earlier. And building on that discussion, I will come back to you and ask you about what evidence and evidence-based approaches do you believe are most critical to reduce the fragility of health system and strengthen their preparedness, particularly in contexts impacted by conflict. And since you have already worked in several countries with a conflict across the region, and how it's affecting on environmental degradation.
Thank you, Dr. Osama. So let me continue with that part. As I mentioned, activities were carried on, particularly as we are with migration, dealing with movement, and ending up in assisting people to return back to their places of origin, or where the best is not to be in the destroyed areas or contaminated. We have this experience a lot, building up the healthcare, rebuilding the healthcare system, with not only with the mobile clinics operation, moving to the solid structure, to the primary, secondary level. We have put that in place, having even in areas that are not accessible during rainy season, for instance, in Darfur, you build up hospital and you don't have the problem for the population that is beyond that river banks that now are full. On the other hand, we have the effective program that was working in every mission when we have the return of qualified nationals, regardless of nationality, starting from Afghanis, going to Sudanese and Somalis, where you bring experts that born, grow, and left the country because of conflict. And they are returning back to do their contribution. And we have seen that in many sectors, be it agriculture, be it the health, be it the water and sanitation. And they have contributed quite a lot, even with their expertise, bringing in the demands that we have to provide for the local authorities and the governments. For health, definitely, we will see more and more air pollution, and we will see more and more need for the chest hospitals, chest infection hospitals, chest disease hospitals. And we are working even now in Egypt to make sure that everybody of these specialists of pulmonologists had the bronchoscopes at the stage, because it's quite high number and will be higher. Because with climate change, we are looking to have more and more carbon-based fuel use that will pollute even more. And normally working on the green energy to have more use in the facilitating the activities in every sector, we will still see vehicles moving around and doing even more pollution. Yeah. And the cities particularly are growing, and we will see this to be expanded, and preparing ourselves to respond to the complications that are coming along with the awareness raising about population regarding the specific disease. Vaccination is one of the things that comes in because we have waterborne disease. We know in Somalia you could have many times having the cholera outbreak because of these issues, definitely. Similarly with the measles having in Lebanon or in Sudan. So these are additional parts that are to be strengthened. And to mention, IOM is quite engaged in part of future compensation for the countries that have not been creating so much pollution, but they are ending up to have most of the effects of it. You can go to Somalia, you can see the forest destroyed. 80% of its part in Jubaland, you have made in charcoal that is transferred to Gulf countries and Yemen. On the other hand, you need to reforest it, you need to have the economy to work, and to have migration that was happening from the central Somalia towards Jubaland, regardless the political situation and tribal association, because there was no other work. But production of charcoal is quite with pollution, similarly to Kuwait burning oil fields. So from our end, as I am, okay, we'll work with the UN agencies, with governments, with entities, private partnership, because we were doing quite a lot with Japanese companies when we had to have the potable water to be created with polyglue, for instance, technology, right? As well as to have the collectors where you will have pure water, less to be worked and decontaminated, because we will see more and more use of pesticides that will affect even worse in the future. And to make sure that the poultry industry is there because it feeds the population faster, and to not have this drought and famine related and deaths and malnutrition, because having this situation where you don't have enough production of the food.
Thank you so much, Dr. Simon. Appreciate it. Thank you so much. So, ladies and gentlemen, as we come to the end of today's webinar, I would like sincerely thank our distinguished panelists on their valuable insights and reflection. Today's discussions remind us that the conflict-induced environmental degradation is not only an environmental issue, it's also a climate issue, it's a displacement issue, and it's a very important as a public health issue. Across the region, we continue to see how conflict, climate stress, water insecurity, and the fragile health system are intersect and affect the most vulnerable communities. What is clear today discussion that is no single sectors can address these challenges alone. We need a stronger coordination between governments, humanitarian actors, academia, civil societies, and communities themselves. We have also needs evidence-based policies, practical adaptations, and health system that prepare to include all that and resilience. So from my side and on behalf of the organizers, I would like again to thank all the panelists once again, and also to thank all the participants who joined us today and contributed an important conversation. We hope these webinars and this webinar will not be the end of the discussion, but rather than starting a point of stronger collaboration and collective action. Thank you all, and I wish you a pleasant day. And over to you, Ms. Norhan. Thank you so much.
Thank you, Dr. Osama. Thanks to all our esteemed speakers for their really meaningful interventions. And in this context, one of the key takeaways from today's discussion that I would like to add is the importance of knowing more about this nexus in order to act adequately. So to support this, and in recognition of the World Environmental Day tomorrow, which happens to be tomorrow, we are offering an exclusive 20% discount for enrollment in the Climate Change and Health Certificate. The certificate aims to enhance knowledge and skills in addressing these complex challenges. It's accessible throughout our online learning platform, GLAD, and it was intentionally designed to be regionally relevant, accessible, action-oriented, and also soon to be launched in the Arabic version too. So the certificate is composed of 4 self-paced courses covering the topics that you can see on the screen. Individuals may have the choice to undertake individual courses if they are interested in a specific topic, for example. But as soon as they complete the 4 core courses, they will receive a certificate in climate change and health. And all of our certificates at GHI are EUB GHI certified. And we have specific tracks for institutions in case they are interested to purchase for their own organizations. So the 20% offer is valid for the next 10 days until June 4. If you're interested, you can simply scan the QR code on the screen, enter the promo code, and complete your registration. So as we come to the end of today's session, I would like to extend my sincere thanks to our distinguished panelists and moderator for sharing their valuable experiences and insights on this important topic. Also, thanks to everyone who joined us today, and this marks the end of today's session. Have a wonderful day ahead.